In this session, you will learn to differentiate movements of the lower and middle spine from movements of your neck. Observe how your lower back and middle spine will move backward while your neck arches. You will need a chair or surface of a desk for this lesson. Please bring your elbows on the back of the armchair or the desk. And support your face and head in your palms so the weight of the head is in your wrists, forearms, and your elbows. While you are supporting your head in your palms, begin to make a movement of entire spine forward and back, as in rounding your back and as in arching the back. Your pelvis is rocking forward as you arch the spine and backward as you allow the spine to flex. Tilt your pelvis forward as you arching the back. Tilt your pelvis back as you allow the spine to flex, to forward bend. Move within the range of ease and feel that at certain moment the spine gets taller, longer, and then the spine gets smaller. You will sense that the distance between your head and the pelvis is increasing and then starts to decrease, and then it passes again through this full length as it shortens again. Feel the spine gets definitely shorter when the pelvis is tilted back. But as the pelvis is tilting forward, also at certain point, the back starts to shorten and arch creates shortness of the spine. Now slowly start to release the extension and feel when is the moment where your spine is the tallest. Continue the movement forward and back, exploring the moment where your spine, where your head to pelvis distance is the longest. Work only within the range that's easy. Tilting a little forward, tilting back. Pay attention to your breastbone. Breastbone sinks down when you tilt your pelvis back. The breastbone pushes forward and up as your pelvis tilts forward. Feel your breathing. When do you inhale and when do you exhale easiest? Try inhaling when the pelvis tilts forward and belly expands. Inhaling, the belly goes between your thighs. Exhale, tilt your pelvis back. Allow the belly to get pulled in. Inhale one more time as the belly expands and tilts forward. Exhale as the belly goes in. Now do the same with opposite breathing. Inhale as you go backward with the pelvis. Exhale as you tilt your pelvis forward. Inhale as you go back and spine gets round. Exhale as your spine gets longer. How does this coordination of breathing and moving feels to you? Go back to the first way of inhaling and tilting the pelvis forward. Exhaling and tilting your pelvis back. work only within an easy range. Your spine between your shoulder blades is like a skewering motion. The spine rounds, gets shorter, and then there is a sense of skewering, that length of the spine and support that your head is receiving from the spine. You'll feel like the head is getting pushed away from the pelvis. Very good. Please bring yourself back to upright sitting and notice, what's your sense of uprightness right now? How does your skeleton support you from your seat bones, from the spine of the lower back, middle back, and your neck? And do the original movement of tilting the head up and tilting the head down, allowing the pelvis, your rib cage, your whole spine to bend forward and bend back. Observe if more of your 206 bones in your skeleton are engaged in movement. The movement may be bigger, but it's not the only way to assess improvement. The movement can be small, but more distributed throughout the whole system. This completes our session. Thank you.